And by the way, thank you, the interpreter, for joining us this morning as well, and also our IT group there. Good morning, everyone. Welcome to Howard County's Fiscal 23 Spending Affordability Advisory Committee. My name is Holly Sung. I'm the county's budget director, also the chair of the committee. Very pleased to see a lot of old friends from last year's committee, or some have served in the committee before. We also welcome a few new friends joining for the first time. Thank you so much. We really appreciate your spending your own time helping us provide very valuable advice each year to the county government. It definitely helps us shape our policy and improve our practice in terms of fiscal planning and financial management. So today with me are three guest speakers or teams from different departments. They actually are the one who in the front line of the COVID response. So I will start with a very quick briefing about the committee's charge, as well as the update on certain situation related to last year's report. Then I'll hand it over to them and their team that can provide you very good briefing about some critical services provided to the county, especially during the pandemic. So the host, can you allow me to share the screen? I have a few slides. Okay. I think I cannot put it yet. Okay, try now. All right, can you see it? All right, I think it works. All right, yes. As we just talk about, thank you very much. As we just talk about, these are the agenda for today. I will do a quick briefing, try to keep it in 10 minutes, and then I'll have my colleagues there share all those critical services. By the way, I also see Steve pointed. I'm very pleased that he is going to, he agreed to serve as the vice chair again, and starting in February. He's going to be the one that coordinate the committee in terms putting together recommendation and also the report itself. So thank you, Steve, for helping me again. Okay, so 1 minute about the virtual meeting logistics. I'm very pleased that we're able to do virtual meeting again, so you don't have to travel in a nasty snow day or a cold winter. So just make sure that you mute yourself until you are the one speak. Otherwise, there will be noises in the background. And anyone have IT issues, please reach out to SAAC@howardcountymd.gov. There are a few IT folks actually are providing support, and I really appreciate on that. If you have questions there, try to hold it once the speaker finished his or her presentation there. We usually allow some time for Q&A. And also keep in mind, these are public meetings here, even it's virtual, so it's streamed online, and also later will be posted at the county's website, just to make sure you're aware of that fact. The committee, as most of you know, was a mechanism that was established through the executive order by county executive, and it's intended to be a body that's really provided data-driven, non-political advice to county executive or leaders of the county on budget and financial issues there. And it has a comprehensive committee. We have much bigger group than most other county cities here, and represent different disciplines, different expertise, and also we have representative from nonprofits, our education entities, as well as the legislative branch. The committee is tasked to provide a report by March 1st to the county executive, and it primarily includes key recommendations on next year's projected revenue, GEO-bond ceiling, as well as multi-projection and any financial issues of concern or interest. We usually meet several times in January and February, and the recommendations are based on majority vote. A quick update on certain major recommendations of last year's report. Last year, the committee report was projecting revenue growth of 2.3% based on information available at that point. The final adopted budget was using 2.9% growth. These are excluding use of fund balances one-time funding. So it's very close, and the numbers not matching exactly because there are additional information become available based on year-to-date revenues, economic outlook, minor changes there. And the budget was able to, despite the fact of pandemic impact there, continue to support our education. For example, the county funding to the school system was 20.5 million higher than last year. The prior year, the county also started body-worn camera program in response both to state mandates and also the community demands there. And the budget had to address some non-discretionary costs, for example, annual debt service for our capital budget financing, as well as the first years of annual payment of the P3 project. In order to live within means, the county continued to implement a hiring freeze across board in county agencies there, and also had to implement some other saving strategies to get us through fiscal 22. In terms of debt ceiling, last year the committee recommended 50 million, which is lower than what the county has been implementing in the past, but that reflects the concern on the ongoing and actually continue escalating of our debt burden, and because of both the fact that the county has continued to issue debt to finance its capital project, but also the revenue growth has shown slowdown in recent years there. So the final adopted budget was 2.5 million GU bonds, which is higher than the committee recommendation, but is certainly lower than past the several years, and actually is the lowest in last decade, to reflect the understanding. We agree that we should be prudent and manage debt wisely. In terms of multi-year projection, last year the report was developed in the time of a very severe pandemic. At that point, also the county already has been showing revenue slowdown. Before the pandemic, the actual revenue of the county was already averaging a growth of slightly below 3%. And with the financial risk associated with pandemic, as well as some long-term demographic and local housing changes there, the committee was recommending a projection of revenue no more than 2.2% in the next 6 years, and also notice a continued gap between project revenues and the expenditure requested by different entities as reflecting multi-year projections there. We also noticed the debt burden continued escalating as the second graph show in this page. There are a few other good points made by the report, and the government has taken into heart, for example, about make sure kind of tame the debt authorization in future years beyond the fiscal 22, and we were able to keep that level in the multi-year CIP plan at very close to affordable levels, typically 70 to 80 million, compared to historically the county used to project or wish for more than a couple $100 million every year for out years. So that's a big improvement. In terms of capital budget, we also listened to the committee's recommendation, like be cautious about initiating any new capital project and prioritize maintenance needs, which clearly have been more and more demands that has not been addressed, and making the county make it more costly going forward, and also there's a lot of needs. So as we close the fiscal 21 financial report audit, we were able to set aside quite some pay-go amount from those surplus there as one-time money to help strengthen or sustain investment in maintenance. So that includes road resurfacing, as well as for the first time, we allocate some funding to provide enhanced support to school system renovation projects in future years. The county also improved its reserve in fiscal 21. A few years ago, we started a policy of trying to establish a policy reserve on top of the charter mandate 7%, listening to financial advisor as well as bond rating agencies there. Now it's the 5th year, and we finally meet that goal of setting aside 3% policy reserve, which is great because it gives us actual leverage in terms of financial and economic uncertainty or risks there. In terms of developing comprehensive multi-year strategic planning, we are continue trying to make progress in that as well. We are in the process of working with school system and other stakeholders on long-term projections and to help with realistic multi-year planning. For example, we know that there are potential significant impact from current legislation from state in terms of both providing more funding from the state, significant more funding from the state to our school system, but also it has a lot of mandates. Things needs to get happened. So we are still working together, try to figure out the future impact so that we can put together some comprehensive strategic planning. Financial position, just quick nutshell, we have plenty of time to discuss that in early February when we have more information. But in terms of how we closed FY21, I would say it really surprised everyone in a pleasant way. And I learned from my colleagues in other counties there in Maryland that they actually experienced pretty much the same situation. What happens is we end up really strong. It's actually even stronger than typical year, despite the pandemic. In fact, income tax, take income tax as an example, the growth in fiscal 21 is 3 times the average in the past several years, which is really bizarre, I would say. It's nice, but it's very strange. And after talking with everybody, including the state government who collect the revenue and distribute the counties there, it appears as it's primarily driven by the federal stimulus package, as well as some different legislative changes and also stocks market that could actually pump up some one-time gains that's not likely to stay there or be sustainable. Obviously, inflation also played a role as a driver. It does actually cause uncertainties there because, as we just mentioned, some of this are not likely to stay there, and which is already reflecting year-to-date performance in income tax. In the current fiscal year, so far the income tax collected is actually almost 10% drop from the same period last year, which kind of meet our expectation because it seems to be in the process of correcting the base. Nevertheless, last year we did very well. Just give us some leverage going forward. And we do continue to face the risk of pandemic impact given the uncertainty and all the reason, the surge of the cases, which Dr. Rossman is going to talk in a minute. And also the stock market, we don't know how long that's going to maintain. And we also have to deal with the inflation impact on service costs, as everybody understands. Pandemic grants, so we're not going to talk a lot on that because at the beginning of February, we will have a session that dedicates some time to give a more comprehensive picture. But just to give you a nutshell, the county directly received a few different big pots of money from the federal government. The CARES Act funding was already spent 100% to meet the deadline. That's $56.4 million. At that point, it was the beginning of the pandemic, tried to provide immediate response to the pandemic there. The second big pie is American Rescue Plan, and we actually already received $31.6 million in the middle of last calendar year. That's about 50% of the total amount that's supposed to come to the county, and it can be spent through multiple years there. And the county also has been implemented very robust public engagement process with public portal, service, etc., to collect input, and there's a lot of valuable information. We're still in the process of allocating that funding. Some of it you probably already read from the news, such as $8 million to the teachers support and $2 million to the school drivers, as well as $2 million for foreclosure prevention. But we're still in the process of working with everyone to develop a solid plan and also have to stay flexible because new situations still come up for more funding and more needs there. There's also some other grants that individual department received directly, housing department, health and business there, so that continued trickling as well. And there's separate grants there to other entities that didn't come through the county government. For example, our school system by December already reportedly received $91.8 million for K-12 from primarily from the federal government. That also provide needed help for those different entities there. So in terms of future meeting, I wouldn't say anything here, and you can read it when you have time. We only have a minor change related to the timing of the superintendent budget release. So there's a kind of flip of speakers between January 20th and January 27th. The rest are largely stay unchanged from the original plan shared with all the committee members. And I just want to wish everyone a very happy and healthy new year before I hand it over to Dr. Rossman. So I want to pause for 1 minute. Does anyone have questions for now or later? You can always reach me, email questions there. Okay, so Dr. Rossman, do you want to start? I can flip the page for you, or you can put on your screen. Either way work for me.
You can flip it for me.
Okay,
so
go ahead.
thank you, Holly. Thank you, Holly, and good morning, committee members. And yes, thank you for your time and talent in participating in this committee, and Happy New Year to everyone. For those that don't know me, I'm Maura Rossman, and I'm the health officer for Howard County Health Department. And I hope the information over the next couple of minutes will provide you some background information about the health department, and I do have some slides on what's happening with the pandemic. You can go to the next slide. So you can read our vision and mission. This slide, just to let you know, the Howard County Health Department is undergoing strategic planning for the next 3 years. We had completed the previous 5-year plan and decided, due to uncertainty related to the pandemic and other factors, to plan for 3 years and not 5. So, but we continue to be committed to our work in Howard County to bring equity and wellness to everyone who lives, works, and play. We can go to the next slide. This is obviously a busy slide, but if you have the time, you can go back and take a look at it. These are the representative from the CDC, and it's the core functions of public health, and there are 10 essential elements to public health, which all state and local entities are required to do. Howard County Health Department is one of a third of the health departments in Maryland who are accredited, and we're very proud of that, and currently undergoing the reaccreditation process. So just a reminder that we adhere to standards of our business, as other businesses operate. You could go to the next slide. So for those that may not necessarily be familiar, but with what local health departments do, you know, from a very basic level, and this is core perhaps to the message I hope you take home, you know, we are ensuring, obviously we're all very familiar with COVID, but at a very, very basic level, we are ensuring that the food you eat when you go out to a restaurant is safe and safe for you to eat, and that you won't get sick, and that the water that you drink is potable, and also that you won't get sick. Obviously, we live, you know, in 2022, and many of us may not be necessarily thinking about the importance of the safety of food and water, but public health goes back to cholera and other infectious diseases, which basically lowered the life expectancy and had a huge impact. But we continue to do that with particularly our environmental health team. We're constantly providing education to, again, improve the health, anything from youth suicide to opioid overdoses and chronic health conditions like diabetes and hypertension and stroke, which impact quality of life as well as longevity. We continue to provide preventative health services in our clinic, actually seeing patients for communicable diseases like sexually transmitted infections, as well as preventative cancer screening, as well as reproductive health care. And we've continued to provide those services throughout the pandemic while we were able to operate and be open. We, in terms of an equity lens, we try to ensure that residents across our county has equitable access to care. We know we're highly insured, and we'll see on the next slide, county, but even with an insurance card doesn't necessarily mean that you'll be able to find quality health care. And we enforce and develop new policies to help make our community healthier, and also provide guidance on policy to our local government and other businesses and nonprofits. And lastly, we respond to health emergencies and threats, which we'll talk a little bit more in detail with COVID. So this is the first meeting, so I know you'll hear this repeatedly, but we are, when we think about, or when I think about public health, we must consider the characteristics of our community. And I think we all appreciate, I am a Howard County resident. Gosh, I had to think about it, for more than 28 years. And over the 28 years that I've lived here, I've certainly seen both the growth of real estate, increasing diversity. And this is from the last census. Our population has increased almost 16%. We are diverse. You can see 21% are foreign born, 56% white, 20% Black, 19% Asian, and 7% Hispanic. About 14% of our community are Medicaid recipients. 4.5% are uninsured, mostly undocumented. We are relatively young. We know that a quarter are under 18. In previous meetings, I think we've talked about the silver tsunami. 15% are over the age of 65. 5% live in poverty, and 23% are considered ALICE, which means asset limited, even though they are working. So if you added 23 and 25%, we have 28% of our community who live basically paycheck to paycheck. You can go to the next slide. So what are some challenges that we're facing? Well, we will hopefully talk more about funding. I do think funding is a primary concern, at least for mine, in continuing to provide the high level of services that Howard County deserves and expects. The emerging health threats, we're entering year 3 of a global pandemic that will continue. We'll talk about it becoming endemic, and we expect other emerging health threats. Workforce, many of you, I think all of us appreciate where we are in workforce and trying to recruit and retain high-level employees. We'll talk more about that. The pandemic has taught us there's shifting priorities both at the state level and policies, which we're constantly trying to keep up. A very granular example of that is CDC guidance and policies, which seems to change on a daily basis, that forces us to be flexible with our workforce, and also makes challenges with communicating policies to our general public. We'll talk a bit about things other than COVID, but there are obviously other community health issues which are impacting the lives of our residents, and nothing is getting simpler. Health disparities, again, with, I think, well, one of the things we've learned about health disparities, right, even to recognize that they exist, which I don't think we really talked much about, let's just say 10 years ago. But with our diversity of our community, we must appreciate that there are some members of our community that need special attention, that we need to meet them where they are rather than expecting them to come to us. And a reminder that equal doesn't mean equity. And we have, related to health disparities and health equity, our recognition of the importance of social determinants of health. Social determinants of health are the factors in our lives, like transportation, education, employment, that probably affect up to 60% of our health outcomes rather than direct patient care, meaning the services that we receive in our doctor's offices and the hospital. So if the health department, from a population health perspective, is going to positively influence and impact our community, we really need to zero in on these social determinants of health and work with our partners who are primarily charged with working with our community from a social services perspective. All right, so let's talk a little bit about the pandemic. Again, year 3. I don't think in 2020 we really realized that this would continue to go on, but it has. And as it's gone on, you can see various different slides of how we've just continued to adapt and be flexible. You can go to the next slide. When we started with our data, right, we had 0 cases of COVID, and now we are managing not just the number of cases in Howard County, but a variety of different data elements. Holly talked about being data-driven. Howard County Health Department is a data-driven, evidence-based organization, so we are relying on more and more megadata to help inform our decisions. Communication, absolutely key in trying to relay messages to our community about health and safety and the changes, as I mentioned, either from CDC or other levels. We are living during a real time when we are both learning about this new disease and having to adjust policies and recommendations based on either new variants or new science that is coming out. Case investigation and contact tracing is probably one of the it is one of the core elements actually of local public health. We do that day in and day out. For example, with tuberculosis, which there are still people in Howard County with tuberculosis. So public health is very familiar with that, but certainly the case investigation and contact tracing required of COVID-19 has essentially blown that out of the water. Testing, we provide testing at Ascend 1. We help others in our community to expand testing, which hopefully you saw there was a press conference yesterday about continued expansion from county government, enabling expansion of testing within our community. We've also continued with vaccine, both management, the storage of vaccines, which has gotten a little bit less complex, but is very complex, and the vaccination process, including just yesterday, right? And now our 12 to 15-year-olds are eligible for booster. So again, we continue to sort of ride the wave of recommendations and what is needed at the time. PPE, we have a storage room of personal protective equipment that we continue to provide to community members who need it, and enforcement of existing policies related to COVID-19. So all of these things continue. Go to the next slide, but there should be one before, or did I reorder it? I probably, yeah, you can go to I'll follow this. So let's, I reordered the slides, so thanks. So you like data. So this is a slide just showing you over time, the testing surge, you know, in the very beginning on the far left, we really remember we didn't have much testing, or you may not be familiar, actually, in the very beginning of the pandemic, the only places that were allowed to test were actually hospitals, and they had to get approval from the local health department to test a certain patient. Well, fast forward to now, we have a variety of different testing options, and you've heard PCR, rapid antigen, and the latest on the market is the over-the-counter testing kits. And you can see on the far right that this represents the end of December, when there was just a huge surge in testing demand that some of you may have experienced, unfortunately, waiting on lines to get tested. I'm hoping in the next several weeks, with both the expansion that Howard County government is providing, as well as expansion at the state and federal level, that that the wait times, it may become much easier to get tested, but it's very real. And you could go to the next slide. The previous slide represented volume. I mean, it just blown out of the water. If you look at that slope, almost a 90-degree angle. On this slide, it's test positivity. We use this to measure of the people getting tested, how many people are actually testing positive. And right now, it's close to 30% of tests that are performed in Howard County, and that's also just about the same as in Maryland, are testing positive. And you can see, that is even higher than where we were in the very beginning of the pandemic, when only people who were tested were in the hospital and had to meet criteria. So there is, i.e., lots of COVID out there and lots of people testing positive and creating huge demand, both at our testing sites, but also huge workforce issues because people who are testing positive hopefully are isolating and close contacts quarantining, which means there are fewer people in the workforce to do the work of not only our essential needs, but things that we need to continue operating. You can go to the next slide. So this is cases, and again, you can see over time the ebb and flow of the pandemic, which can be related both seasonal aspects of the pandemic that we're learning about, but also changes with the variants over time. And right now you could see almost a 90-degree angle in the surge in cases related to the Omicron variant. Important to note, both from a workforce issue and also just from an emergency healthcare issue, that you can see here that related to the increase in cases, the hospitals across Maryland are seeing an increase in hospitalizations, creating the hospitals to either have to pause elective surgeries or provide what's called crisis-driven services. And much of that, I think, both relates to an increase in the number of folks being hospitalized, but relating to the workforce, that there are many hospital workers who are calling out either sick or having to tend to family members, so they don't have the workforce needed to expand. Typically, hospitalizations lag case data, so it's usually a 2-week lag. So when public health sees an increase in the number of cases, it's probably 2 weeks later that hospitals are seeing a surge. And the surge in hospitalizations that you're seeing on this slide, again, is related to Omicron and surge. Omicron is a variant that I think we all recognize now is more highly contagious or transmissible. So there's just more people getting sick, and also related to the fact that we went through Thanksgiving and holiday, Christmas, New Year's, and many people gathered, which was easier for the cases just to grow and expand. I am hopeful, but unsure at this point in time that that we hopefully will plateau in the next couple of weeks and then see our cases decrease. But that is unknown, and during that time, the crisis care at the hospitals remains a significant concern. So beyond COVID-19, because there are other aspects of our lives that are not just related to COVID-19. Years back, we all, I think, are familiar with the opioid pandemic. I have excellent news to report that during the last year, our overdose fatalities significantly decreased by 50%. So that's really good news, but we have a team of people who are out there every day continuing to work on this effort. Mental health, much discussed in relationship to the pandemic. We are recognizing the toll of that virtual learning has taken on our children, and even the social isolation of our older adults in our community, and even among us who are used to being tiles on a screen, impacting us as we've worked at home, gone into the office, and back and forth. We also recognize, and this is not something that is new, but something that I don't want to say we haven't really had the infrastructure to, and I hope we do now, to focus on, and that's our maternal infant mortality disparities. Despite our great healthcare in Howard County, our education, high educational attainment and high insurance status, there is a great disparity between Black moms and Black infants and their health outcomes related to pregnancy and birth compared to our white moms and babies, and that's a problem that we hope to focus on this year in our strategic plan. And related to birth outcomes is low birth weight and prematurity, which disproportionately is affecting our moms and babies of color. As we age, chronic disease like diabetes and hypertension and cancer remains something that we need to focus on. And I talked a little bit earlier about health equity. So the challenge here for the health department is we're focusing on, obviously, COVID-19, but there's all these other issues that remain at bay that are affecting our lives. And it is difficult. It is difficult to focus on all of these things simultaneously, probably impossible. But I think if we don't pay attention to these other things, once we get through the pandemic, we will be dealing with other crises. So let's talk a little bit about funding. You could go to the next slide. So let's talk a little bit about funding. Howard County Health Department is a state entity, although 100% of our work is focused in Howard County. We receive about 50% funding from the county and from the state. It is important to note that the funding that we get from the county is our most flexible, that we can use for a variety of different priorities compared to our state funding, which is highly prescriptive and typically covers staff in very specific programs. So it is not a choice how we spend this funding or where it is spent on from the state versus county funding. So we really rely on county funding, for example, for youth suicide. We do not receive any funding from the state to focus on youth suicide. At present, we do not receive any funding to focus on maternal and infant health. At present, we receive very limited. We just received a grant to focus on diabetes. And all of these things, as I mentioned before, are a concern. And how important it is that we get, number one, adequate funding overall, but also how important the funding that we get from Howard County government is to our ability to provide the services that we believe Howard County deserves. You can see at the bottom of that slide the federal funding that has dramatically increased over the past 2 years. And Holly mentioned it's a variety of different buckets from CARES funding and ARPA. This, you can go to the next slide, Holly, and you could see the light green federal line. That is all related to COVID spending, and it is a lot of money. You can see that the challenge with this type of crisis-driven funding that historically is how the United States and the state of Maryland since has been funding public health is we get a baseline, which you can see the red and blue lines. That basically is the split between the funding from local government and from the state, and really hasn't changed all that much in a long time. And I will tell you that I believe it is inadequate funding to provide the public health measures that is expected of public health. And this is not just related to Howard County, but it's a systemic problem both in the state and in the nation. And what typically happens is when a crisis happens, Ebola, for example, H1N1, and now COVID-19, that the federal government infuses it depends on lots of money, but in this case, lots of money are provided to the health department, you can see, but they are very prescriptive meaning this and that, for example, that this pot of money may only be used for testing, and we may not need it for testing. We may need it to hire a grants manager to manage the 92 different grants that we're receiving, but that's not allowed. The other aspect of this crisis-driven funding, typically by the time we get the announcement, we're several months into when we could use the funding, and there is a very specific deadline. So it is impossible to use this funding for long-term planning, because it typically ends at the end of a year or 2 years or 3 years, and we, in order to have a stable, what I call infrastructure, this type of funding is not allowable or cannot be relied on. So you could go to the next slide. Again, this is just, you know, I hope at the end of this that from safe water to COVID response, that you recognize that the value of public health. And here you can see from the funding we receive from Howard County government, it comes out to be, you know, less than $1, 74 cents per resident per week for the services we provide. And I, at the end, will argue that it's a great investment in our health, and I'm hoping that that Howard County government will invest more. You can go to the next slide. All right, so what are our challenges? I mentioned adequate funding to support the critical infrastructure that is needed, and in my opinion, the input of crisis-driven episodic funding makes it impossible to develop a stable workforce and programming, and that the current level of funding between the state and county government is really inadequate to maintain all the activities that I've mentioned that we need to address to ensure at least the health of our public. And if we want to concentrate on new initiatives, because new things arise, then additional funding is needed. As mentioned, we are a state entity. All Howard County employees are state salaried. We did a comparison of state salaries compared to local government salary compared to private sector. And there is about a $15,000 gap on average between the state salary and other comparative salaries. So it makes retention of high-performing employees challenging when they can go out and get a job, you know, for a job that's equal in responsibility, that's $15,000 more money, and certainly makes it difficult to recruit high-quality candidates. And just to note that the state salaries and even response to the pandemic, in my opinion, has been inadequate. And this is just an example. We have staff working multiple shifts, 7 days a week. Again, with the waves of the pandemic, that changes. And for all actually of our nurses and other staff, that overtime is not permitted. So you have staff working, earning what's called comp time, but because of the nature of our business and we're not that deep, you're never able to take off. And I've exhausted all options from the state level, and I want to personally thank the county executive and county government for providing what I'm going to call bonus pay or supplement pay to our staff to not only just acknowledge the work and value that they're doing, but to adequately compensate them for the work that they are doing. So we did an analysis of, again, I mentioned, of salaries, and we submitted a proposal to county government. And this is where we are hoping that we could have additional funding. You can see there's two options. The first option would expand what's supplements to 100% of our staff. There currently are staff who receive supplements to retain them, but expanding to 100% would require an additional $2.1 million. and you could see that basically comes an additional 12 cents per resident per week. I see there's like a typo in there. So it would raise us to 86 cents per resident per week in order to hopefully close the gap between state salaries and salaries of other positions surrounding us. And option two, less funding, an additional 763,500 would increase the number of staff who could receive supplements, and we would target it on middle management, technical, and hard to fill positions. But in my opinion, every employee is valuable in the health department, and therefore option one really is what I think I need to that we need as a county to continue our efforts with the health department. So that is it. Just some pictures of our public health heroes over the past year. And I want to thank all of you for your continued support of public health, of our staff, and our community.
Thank you very much, Dr. Rossman. This is very comprehensive, and also appreciate that great update about the current situation, but also beyond COVID, the underlying other issues that health department has to address on that. I want to just give a couple minutes to the audience or the committee. Does anyone has question? If so, please just unmute yourself and you can feel free to jump in.
Could you comment on the relationship with the Horizon Foundation and any collaborations that you have there that help with the budget?
So we have been a collaborator and partner with Horizon Foundation. I'm going to say for decades, right? Horizon Foundation does not provide direct support to the operations of Howard County Health Department. We have received grants from Horizon Foundation to work on very specific projects. Currently, we're not receiving any funding from Horizon Foundation.
So no other questions?
I have one other question on your, which as you alluded to, everyone is dealing with staffing. I'm particularly curious about the kind of medical staff that you're competing with, you know, crossing both the hospital staff, but then the healthcare spectrum, because I would assume the health department has a pretty wide range that is competing with all of those. Is that accurate?
Yeah, I mean, we employ physicians, we employ nurses, we employ back office workers, but also environmental health. So it's a broader spectrum, right? But in terms of, yes, we are competing for IT. I mean, you didn't mention this, but there's healthcare IT. We are competing with all the other IT industry in terms of trying to get, you know, IT as well as healthcare worker staff. So yeah, we're all competing with each other, aren't we?
Yes. And that number then really crosses that full spectrum. That's what I was looking for. Your funding request really does kind of go through your entire staff portfolio. Okay.
She's not paying staff from county.
When you mentioned the uninsured in Howard County, you said it was mostly undocumented. Is that did I catch that correctly? That it's by and large undocumented workers that are uninsured, and that's the only cohort of uninsured population we have?
Well, yes, because in the state of Maryland, we have Medicaid. So anyone who is under a certain income is eligible for medical assistance. So there should be no one who is of documented status who is not eligible for Medicaid. Now, of course, there may be some people that just have not completed the application and may be uninsured, but they are eligible. So that is why I said that 4.5% probably must represent the undocumented, because everyone else should be eligible. What is not said there is for folks with employment, there are some employers that actually have very high deductibles. So that doesn't acknowledge residents who have very high deductible copay insurance, but are insured.
So Dr. Rossman thinks that we're going to post this video on the website. I assume the public might have the chance to look at it as well. Do you have just one last piece of advice for the public, especially given the recent surge of pandemic?
I'm sorry, Holly, I wasn't able to thoroughly hear the question.
Oh, Dr. Rossman, just like since the public can see the video, any piece of advice for the public?
Thank you for that platform. Yeah, thank you for the platform. Yes. You know, I understand these are very sort of anxious times again with the surge that we are currently seeing. Please, number one, if you aren't vaccinated, get vaccinated. If you need, if you're eligible for your booster, please get boosted. Vaccine is the best way and most effective way to prevent serious illness and death and keep you out of the hospital. To wear a mask when indoors, wash your hands, and I'm going to end with be kind to each other, because again, these are very stressful times, and kindness will go a long way. And if anyone needs help with either vaccination or finding testing or finding a mask, please go to our website and we can hopefully help you with all those things.
Thank you so much, Dr. Rossman, and you and your staff for the fantastic job and continued in this time. Thank you. So our next speaker is Kelly from Department of Housing, and that's another subject that is of a lot of interest to the community. And also, again, you and your staff also did a lot and continuously in this period of time. So Kelly, do you want to start? I actually have the slides on the screen. I can flip it for you.
Thank you, Holly. Good morning, everyone. And this is not a snow day like I used to remember them. So we all get to still come to work. So, so I'm Kelly Simino. I'm the director of the Department of Housing and Community Development, and I appreciate your time this morning. Similarly to the health department, we receive funding from federal, state, and county sources. However, we are a county agency. Our main charge is to create and preserve affordable housing units for low and moderate income residents in Howard County. We also provide funding for homeownership, for down payment and closing cost assistance. And one of our other roles is to provide homebuyer education classes to help encourage homeownership in the county. Each year we receive federal dollars from the Community Development Block Grant Program and the Home Investment Partnership Program. We are an entitlement jurisdiction, so we receive those funds directly from the Department of Housing and Urban Development. Similarly to the health department, for the last 2 years, we have been very involved in providing COVID-related relief in terms of rent, utility, and mortgage assistance. And we, with each grant, there have been different terms and different requirements, but the most recent funding provides assistance for up to 18 months of rent and utilities, and also for mortgage payments. Next slide, please. For the Department of Housing, we have a few funding sources. The main source of funding for us is a percentage of the county's transfer tax. We are very fortunate that real estate is very popular here in Howard County. There have been a lot of real estate transactions this past year, so we do expect to receive a more than level funding from last year of our county transfer tax. We also receive moderate income housing unit fee in lieu revenue. This is revenue paid by builders who do not build moderate income housing units, but instead pay a fee to the county so that we can provide moderate income housing units elsewhere in the county. I'd like to stress that this income is not, builders that build moderate income housing units are required to do so for townhomes, condominiums, and apartments. This revenue generally comes from single-family detached homes on large lots. It also does have one exception for age-restricted properties. So sometimes if a developer is building age-restricted units, they can choose to pay fee in lieu instead of providing units. But I just want to clarify for that wherever there is a moderate income housing unit requirement, most builders do include moderate income housing units in their new communities. We also receive a small percentage of interest income, and then our grant funding from the federal government for our CDBG and home dollars is about $2.6 million per year. What do we do with that funding? Again, our charge is to help acquire affordable housing units, preserve them, rehabilitate them, and provide education to the residents in our county on how to find affordable rental and homeownership opportunities. Our grant funding also helps with acquisition, rehabilitation. We also can do things such as public facilities. If any of you have ever been to the Roger Carter Center in Ellicott City, some of our federal grant dollars were used to help fund the construction of the Roger Carter Center. So that's about our budget. We do have, this is not including COVID funding, but our budget is about almost $12 million per year. Next slide, please. So two of the programs that we work very much on is some of our home ownership initiatives is our moderate income housing unit program. So you'll see down on the right that we have a home ownership program and a rental program. And the goal each year is to expand the number of units that participate in this program. Both of these programs keep units affordable in perpetuity. That means once they are an affordable unit in the MIHU program, they are affordable forever. So for FY21, we increased our affordable homeownership units to 347, and our rental units increased to 770 because 2 new rental housing communities opened, and we received 10 or 15% of those units as affordable moderate income housing units. So homeownership units in the moderate income housing unit program serve households up to 80% of the Howard County area median income. Our area median income for this new year will be $121,160. So 80% of that for a family of 2 is $77,542, and for a family of 4, that is $96,928. This means that households earning up to those amounts would be eligible to participate in the homeownership program and be qualified to purchase units that builders have designated as moderate income housing units. Currently, our moderate income, no, not yet, Holly, sorry. Currently, our moderate income housing units average a sales price of about $275 to $370. These prices are approximately $200,000 to $300,000 below the market rate prices. So as you can see, this program is really helping us to create homeownership for our moderate income working families here in the county. Regarding rentals, our average moderate income housing unit rent for a 2-bedroom unit is around $1,450. That is, again, about $400 to $600 below the average rents for the market rate units. And our rental units serve households earning up to 60% of the Howard County area median income. So for a family of 2, that's about $58,000. And for a family of 4, that's about $72,000. So again, we're trying to really provide opportunities for our working families here in the county. Regarding our settlement down payment loan program and workforce development loan program, these both work in conjunction with the moderate income housing unit homeownership program. We are very excited to be able to offer these loans because saving money for a down payment and closing costs is a significant barrier for moderate income families to be able to become homeowners, especially in our county where the costs are so high to purchase a home. So in FY20, we provided 56 households with homeownership assistance with down payment and closing costs. In FY21, we increased that to 62. And this year we're on target to potentially help almost 80 households with down payment and closing cost assistance. Many of our residents that receive these loans receive an average of about $22,000 to help them with down payment and closing costs. And each year we have been increasing this a little bit. In FY22, we set aside $1.6 million. For next year, we are setting aside $2 million because we know that there is an extreme demand to increase home ownership here in the county. This is an initiative of our county executive. And also new home building is still moving forward. And with each new home community, we receive new moderate income housing units to award for rental and home ownership. Next slide, please. We as a department are very small but mighty. We have been awarded a lot of federal dollars as a result of COVID. We normally receive about $2.5 million per year in federal dollars. This year we will receive, or since the pandemic began, we will receive $33 million in federal or state funding. And this has been a very heavy lift for the department, but we could not have done it without our nonprofit partners. Many other jurisdictions took all of the COVID rental, mortgage, and utility relief program and brought it in-house to their departments, and they significantly staffed up, and they had to really put a lot of effort into doing this program. We knew that wasn't an option for the department, so we partnered with our existing nonprofits in the community who already work with our residents in the community, our Community Action Council, Grassroots, Luminous, Bridges to Housing Stability, Springboard Community Services, the Housing Commission. We worked with our existing partners to get this money out into the community as quickly as we could. So as of December 30th, we have already spent 55% of the money that we have been granted. And so we feel that this was the right approach for our county. Our nonprofit partners have the caseworkers, they have other resources, and they have really been able to help many of our families avoid eviction or foreclosure. We are managing the foreclosure prevention program in-house, and so far we have assisted 69 households prevent foreclosure. And we also are working with the United Way to do bulk evictions, where landlords who have at least 3 tenants who are behind, they can provide bulk eviction assistance to keep as many residents in their homes as possible. So as a result of our efforts with all of our amazing partners, 2,141 renters or homeowners in the county have been able to stay safely in their homes. Next slide, please. We also, when this started, we realized that we needed a way to manage our data. We did not have a robust system, as the health department does, to do all the metrics and tracking. And we knew this was important, especially for equity. We needed to know where we're helping. So we contracted with a provider, it's called Prefix, to give us this snapshot. This database also allows residents to apply from their mobile phone. So that eliminated the issue of broadband access. If they had their mobile phone, they could apply for rental and utility assistance, mortgage assistance. And so we felt that that was really important to help residents overcome barriers, specifically since many offices were closed due to the pandemic or reduced hours or not letting people come in. Paper applications just weren't feasible in order to get this funding out to people. This platform has been amazing for us. It's been able to give us where the assistance is going, targeting it by community, targeting it by zip code. And we've been able to use that information and share it with other agencies such as our Department of Community Resources and Services so they could help organize food drives in those communities. We've shared this information with the health department so they knew where there were populations that maybe needed vaccinations or maybe needed other assistance. We also have been able to work with the food bank where they can take food and deliver to residents in communities that have been severely impacted and unable to pay their rent. So this data has been very helpful in helping us do a countywide effort to provide assistance to the residents most in need. More than 50% of the residents who have received help to prevent eviction or foreclosure have earned less than 50% of the area median income. So we are really helping our most vulnerable residents stay safely housed. This information is posted on the Housing Department's website every month around the first of the month so that our community can see how we are making a difference for our residents. And next slide, please. This is contact information for myself and for Tom Wall, our fiscal specialist. If anyone has questions about our general budget or our programs or our COVID-related assistance. Thank you.
Thank you very much, Kelly. Again, heavy lifting, as you're saying, you have a very small staff. And as you said, very fortunately, we have a lot of nonprofits in this area that provide needed hope and collaboration in this period of time. But thank you and your staff for working so hard in this period of time. So again, committee, and did anyone have questions there? Please just unmute yourself and feel free to.
Kelly, this is Joan Dreesen.
Hey, Joan.
I am just wondering what you anticipate happening as these emergency funds are depleted. I know some of the nonprofits are concerned because they have staffed up to do the rapid rehousing and to administer these funds and education. As these funds disappear, as crisis funds do, there's a real concern about how they continue to meet the need that's in the community. So I don't know if you have any thoughts around this, or you just share that concern.
Sure. So we have consistently communicated those needs to the state and federal partners. We have applied for additional funding from the Treasury. We have applied for additional funding from the state. The county is very aware of our need for additional funding. This is a huge challenge. The fact that many of our residents, again, our lowest income residents, our most vulnerable residents, are cost burdened with housing costs, that does not end with this pandemic. And the fact that we do not have a sustainable rental assistance program beyond the Housing Choice Voucher Program, which has the waiting list has been closed for 12 years, is a real concern for us. And I know that our nonprofits are struggling. And all I can tell you is that we are continuing to request additional funding from our federal and state partners as they reallocate for jurisdictions who maybe didn't perform as well. And we are starting discussions on how we can continue to assist residents with potentially ARP money or different funding sources. But yes, this is a real concern and we are discussing it. Thank you.
Thank you. And also thank you for the incredible work that you have done and for being such a great partner. So
thank you.
I don't think this community understands fully how hard you all have worked there. So thank you.
Thank you, Joe. Thank you.
Are there any limitations on the COVID rental and foreclosure assistance? Like, does it have to be spent in a certain period of time, or, how confident are you in getting the remaining 45% out the door?
We are very confident, and yes, thank you. All of the programs were very specific. Some had a 6-month rental assistance period, some had a 12-month, some had a 15-month, some had an 18-month, and managing all the different grants has been another reason we needed that database so we could monitor this. All the families that participate must, their income cannot exceed 80% of the HUD federal guidelines for any of the federal dollars. For the state dollars or the county dollars, we were able to use 80% of Howard County area median income. So again, the department has had to really be careful to make sure that the funding that is used for a particular resident, that they meet the income guidelines for that particular funding. I am 100% confident that we will spend all of this money. It is likely we will spend all of this money in 2020. We are in 2022. We will spend all this money in 2022. Some of the funding, for example, the Home American Rescue Plan of $1.757 million actually has a 3-year spending period. We won't need the 3 years. Everything will be done probably this year, if not by mid 2023.
Thank you, Kelly. Okay, if no more questions, we'll go to our next speaker. Also very, very important subject. That's from Jackie's department heads, and she and her team will talk about the service provided Department of Community Resources and Services. That's again another agency has been engaged in the very beginning and throughout the pandemic so far. And she and her staff are so dedicated and probably exhausted by this time. But I'll let Jackie take the ground. Jackie, are you available? Yeah, go ahead.
Thank you, Holly, and good morning. Thank you, everyone, for giving us the opportunity to have a conversation with you today. I am joined by 3 of my senior team members, my 2 deputies, Stephanie Adibe and Cheryl Mattis, and my fiscal officer, Sean Hollywood. So in the event that we have some questions, we're happy to have a conversation with you today. Holly, I'm going to ask you to stay at this level of the slides for just a couple minutes because I want to be able to take advantage of this time to have a bit of a conversation with you. The slides that I've provided are filled with numbers and charts and details, and some of you have had the opportunity to hear me speak to this group in the past, and some of you I know from the community, but for those of you who don't know me, I am Jackie Scott, the Director of the Department of Community Resources and Services, and the first set of the slides that I provided give you an overview of who we are, the components of our department, and tell you a little bit about the numbers. Our budget, those kinds of things. And then the second portion of the slides really focus on our COVID response. And so I want to be able to drill down into that a little bit in the time that I have with you, and then in the conversation around some of our critical needs. So I'm not going to go through all the slides in detail, but I would encourage you in any of your spare time to be able to look at those. And if you have questions, please make sure that you reach out, and I'll be able to provide more information to you. So we can go to the next slide now. Just as an overview for you who don't know much about the department, and we can stay here for a moment, is that we are, I tell everybody, we are really the human service agency for the county. We have a sister agency, the Department of Social Services, which is the state agency who operates here in Howard County and is really co-located with us over at Patuxent Woods, and we work very closely together. The difference between our work is that while we serve a very deep end population in the Department of Community Resources and Services, we really are focused on serving everyone in the community. We are the kind of agency that you don't need until you need us. And so most all of our programs are not based on poverty levels. You can come to us after being a business owner who has now found themselves in a divorce or having a death in the family or an illness and have quite a bit of assets, but still need services. Your vulnerability may be that you are living with some sort of health issue, or you've had an accident and need, equipment or services. You may just want to have exercise and wellness. So we have the scope. We have 9 offices under our directorate. You can go to the next slide. And we provide support to 10 commissions. And so we cover the lifespan from our very youngest to those who are most vulnerable because of being survivors of human trafficking prevention, those who are our older treasures in the community. And guess what? If you bought a lemon and you need to understand what your contract or your lease is, we have the Office of Consumer Protection there too to help you. So our breadth is quite big. Next slide. We have over 160 employees. We have various roles, which I won't go through all of these here, but we'll talk about them as we move forward. Next slide. We have the fortunate ability to also be a funder and a huge partner of our nonprofit community. So when you look at our budget, you will see that our budget is now over $26 million in operating. And we also give significant grant dollars out to the community. Over $8 million of those funding dollars come from our county funds. And then we have what we call the continuum of care dollars, which come from federal and state grants to support the housing needs and the homeless population and all kinds of things for our deep end populations that we have here in the county that need assistance. So we have quite a diverse funding stream that comes into the department. Next slide. These next couple of slides point out a couple of key factors. One big takeaway I want you to know from this conversation today is that you will hear me talk about a lot of work that we do. But if you pay attention to this first slide and you look up at the top of county general funds, we are basically about 2% of the county's funding. 1% is directly related to DCRS, and the other is related to our distribution of CSP funds. So when you look at what we do, we are a mighty machine, and we do it at really, really low cost for the county's overall budget. So when we talk about our needs are sincere in that we know we don't cost a lot, we're a bargain, but we actually have big shoes that we're walking in to serve the community. Next slide. This tells you a little bit about our allocations, and we can spend time on this if you have questions about this. But our largest office is our Office on Aging. So if you look at how our funds are split, the allocation is really just about right in terms of the size of the offices. Our 4 largest offices consume the largest portions of our work. Now, that doesn't mean that those smaller offices that we have don't have expenses and don't carry significant loads. They are just smaller in staff. But our consumer protection team, for example, is a mighty team of 3 people, and they have handled everything from the intense caseload of landlord-tenant discussions to, as I said, somebody has a lease, somebody has been scammed. So that small office may not take a lot of general funds on this chart, but they carry a significant load. And that's a theme of what you will hear throughout this discussion. Next slide. This just gives you a sense of our expenses by fund. And the next couple of slides will go over some of those details a little bit in depth. But what I'd like to point out here is that for a department like ours, over 80% of my budget is people. We are in the people business, and it takes people to provide the services to the people who need us in the community. And so we have very little wiggle room in our budget. The areas that are most significant are, as I said, our people. And then we have those immovable expenses that really go towards what we have to pay in terms of chargebacks and other things to keep the organization running. Our IT infrastructure and other things that each department has to pay into their share of. Those are immovable costs. So when we're asked to think about how to deal with any kind of budget reductions or cost containment, those things come from people. And so over the last couple of years, we have been in situations like everybody has, where we've had to pay attention to our budget and make some really tough choices. So we've had to take hits in our staffing. And so there are staffing issues that we have faced with regards to not being able to fill positions for very understandable reasons. And yet, in a pandemic, we've had to rise and continue to provide the services to people. And so I'll talk about how we've done that a few slides into this presentation. But I just want to make sure people understand we're the kind of agency that really doesn't have a lot of wiggle room in how we operate and what our budget is. Next slide. Again, this is another slide that demonstrates our COVID impact because we were doing really well in supporting our work. Like many businesses, we have a business model. We're human services, but we have to operate in a business model. We have provided a lot of services over the years for which we are able to generate revenue, our classes, licenses, things like that. And over the years of the pandemic, we have taken a significant hit in our program revenues. And so we've had to look at those shifts and figure out how to compensate for the loss of revenue. We don't think anytime soon, like many businesses, that we'll really recoup those dollars in the short term. It will take some time. For example, when will our seniors feel more comfortable to come back in and take group exercise classes? When will, people feel that they're comfortable to come inside again to sit for large scale classes that have to license childcare providers? All of those things that we do that help run the business have caused us to really think about and pivot in how we do our work. Which means on the other side, significant investments in things like technology and training to change our business model. Next slide. So the other big piece of our work that many of you may be familiar with is our Community Service Partnership Program grants initiative. So for years, we have provided funds to our nonprofit partners to walk alongside us and do not only their mission, but also help the county meet their mission in caring for our most vulnerable. This slide lays out to you how those dollars are disseminated throughout the county in terms of the various categories: operating grants, one-time grants for needs. Supplemental funds are those funds at which we are able to allocate dollars for things that come up in client assistance needs. If an organization needs some additional support to do strategic planning or reorganizational needs and they need to hire a consultant, we work alongside our nonprofits to help support their ability to strengthen themselves and meet their goals. Next slide. This gives you a little bit of an idea of where we have been over the years to kind of provide the support needed. For many years, there was a steady increase in the support given to the nonprofits. As the county has grown and changed, the needs of the nonprofit community grew and changed. Over the last few years, though, we've had to level off, and our grants program has been one that has provided level funding to our nonprofit community in order to be able to stabilize our budget and our growth. As you've heard from Holly in the past years, we've all had to take a hard look at our fiscal responsibility. And so we've done some level funding, and we will be doing that again this year for our nonprofit community in our CSP grants program. Next slide. So in that vein, also, we have entered into a redesign project for our community partnerships grants. And over the past year or year and a half, we have worked with the community to redesign the CSP program. There is a report, there's a hyperlink here that's located on our website that lays out that redesign. but we really are focusing on creating a grant program that better allows us to look at the return on investment and to chart courses that are based on data, and really drive some equitable measures focused on equity, both in funding and in the services that we are funding into the community, and looking at the impact on those who are receiving those services. So I'd encourage you to take a look at that report on our website. Next slide. So I'm going to spend a minute here before we go into these, just to sort of quickly summarize what I hope will be some takeaways from that very quick overview of the department. Again, we're very small portion of the general fund, only 2%, but our impact outweighs what that 2% really tells in the story because of our involvement in so many different things. Our general funding, like I said, 80% of what my budget is people. Our program revenue, I talked about that, took a huge hit. And we are looking at how we're going to respond and provide those kinds of services that were funded. For example, our child care providers still need training. Many of them cannot afford to pay because they've been hit so hard in the pandemic. Well, we're not going to not train them. We're simply offering those classes for free. Our commitment is to figure out how to continue to serve whether or not we're able to generate that revenue or not. So what does that mean? We've been able to shift our reliance on some of that funding. As a strategy, we've moved to grants. We have done our part to share the lift of the burden to fund the needs of the community. So we have gone out and we have received an increased number of grants to support our office of, for example, our Office of Children and Families, our local Children's Board, our Office of Community Partnerships, and our HUD grants, and our federal funding, and our Office on Aging. We have significantly increased our grants program for our internal grants to support the work to the community. So our staff is voraciously going after grant opportunities to supplement and offset any weight or burden of any lost revenue or any inability to increase hiring and support those staff from county dollars onto grant dollars that we're able to bring in to meet the needs of the county. So that has been a strategy for us that we are going to continue to do because of the increased need. During the pandemic, as we get into this conversation, you'll have a little bit of background very quickly, in that we received direct grants to support our work from the pandemic, totaling over $1.5 million. We were able to do that through funds that came in from the federal and state dollars, directly to programs that we support anyway, Office on Aging, some of the HUD dollars, others. Now that is above and beyond what the county received through CARES Act and through our ARP dollars. So we have multiple funding streams to support the work that we've been able to do in COVID. So I'll jump into that part of this conversation to share with you a little bit about that. So this will be a high level. There's a lot of detail here I'll encourage you to read about. So next slide, Holly. So where we have been focused in our response is sort of that hierarchy of needs in a family or in an individual. Food, shelter, health and wellness and well-being, both physical health and mental health. So our offices have been engaged in a great deal of food access work through our Office of Children and Families, our Office of the Local Children's Board, and our Office of oh my goodness, community partnerships. We have served a significant number of meals and meal kits to children and families throughout the county. We have used our data to map from an equity lens and distribute throughout the county where there have been gaps or significant needs of families that we know don't have access to food and nutrition. Next slide. We have also done a significant amount of work to support our older adults. As you will be able to study, it's a lot on this slide, but what I want to say to you when you look at this, when you have a chance to really look at it, is that our Office on Aging and Independence has worked hard to meet the needs of our older adults over these past 2 years in this pandemic. We have distributed an immense amount of meals, and these services, I will say to you, most everything that we have done with regards to food and utility response and all of the things that we've done. Again, I'll say to you, we don't ask income, we don't ask status. If you need it, we will provide it to you. And so our seniors, some of who, yes, have been socially isolated, some who are low income, others who have had just other challenges, have come out week after week. These are weekly programs that are continuing to have, oh, I'm sorry. Oh, significant snowfall here. I'm going to show you with my we have had, significant need that we've just continued to reach. We've also taken an intentional equity lens to this work, in that you will see that we've done
Excuse me, Jackie. Jackie, if you're not speaking, can you please mute? I think we're hearing the snow forecast update on the TV.
Thank you. So just take a look there. We have tremendous need in our older adult community. And so I wanted to make sure that I shared that. The next slide also shares with you the overall work. And there's a lot here, I know, but the overall work during the pandemic for our Office on Aging. We have had significant interaction with our older adult community to ensure that we are aware of their needs, that we are connecting them to services, and that we are making sure that their health and wellness and mental and emotional health are taken care of. You heard Dr. Rossman talk a little bit about social isolation and mental health, and we've seen it on two anchors, our young people and our older adults. All of us have felt the stress, but we have paid close attention to making sure that our older adults are cared for during this time. So next slide. Now, this set of services in partnership, some of which you heard Director Semino talk about, and having Dr. Rossman and Director Semino here today with us is really much like we've been operating throughout this pandemic. They're some of our closest partners. And so we do a lot of our work together. The housing piece here is really about our continuum of care, our deepest end populations that need housing assistance. So during the pandemic, we were working on eviction prevention and utility assistance and disseminating dollars through our Office of Community Partnerships. We provided shelter services. We also made sure that we were working closely with our Housing Commission to get people permanently housed during this time, so they were not rendering between, unstable households or living in cars or hotels during this time. Next slide. This also continues to show you some of the work we did. This area here, as you know, during the pandemic, it's very difficult to be in congregate kinds of sheltering. So we engaged hotels. We worked very closely with our grassroots partner to make sure that our shelter was safe and well-funded, and that we had the right kind of housing available to people. So we managed the non-congregate sheltering. We also manage and continue to manage the program around COVID positive hotel. So we had to create a program for those who found themselves with no place to go or in the inability to be in a setting in a shelter if they were COVID positive. So we staffed those hotels. We made sure that people had meals delivered. We worked with the health department to make sure that they had wellness visits. And so we had very supervised and supportive staff working with those folks while they were in isolation because of COVID. And so you'll see at the bottom of this slide how we supported a lot of those efforts. Next slide. So now I want to move to mental and emotional health, which is significant. This information on this slide, when you get a chance to review it, is really about a lot of the work we did with our children to support our education system and support our families during the COVID pandemic. We were very proud to be able to provide an on-site program during the pandemic for our middle schoolers. Those folks who are just not quite old enough to be on their own at home while parents had to leave the home to go to work, and who were a little too old to be feeling like they needed to go to daycare. So we identified the need, we identified locations and populations that needed these learning supports, and we provided in-person learning classrooms where students were able to log on to their courses, but they had a person there with them in a setting to make sure that they were doing their work, they were getting social and emotional learning activities after that, before and after school kind of activities to ensure their mental health and ensure that they were honestly able to succeed academically. It has been one of our most successful efforts and most successful partnerships to support the work alongside the school system. Next slide. So these are just some of the things that we did to support our community in other ways. We worked with our faith-based communities to increase an equity and diversity outreach program to ensure vaccine clinics were being run. We ran them in the community alongside the clinics that were being held by the health department. We worked with the fire and rescue to hold community-based clinics. We also funded our community partners to be able to work with us to go out into the community and provide direct support to families. So whether or not that was food, utility assistance, or whether or not they were actually hosting clinics for us, so that we know that people are not always going to come to a government building, and accessibility is key. Our model is to take whatever we can, whenever we can, to the community and make it easily accessible and understandable for people. We provided backpacks and school supplies to students who needed them. We provided coats in the wintertime. We provided food at the times of the holidays. So a whole host of supports, in addition to making sure those who are farm-born and undocumented were not lost in this this time period. We did direct outreach. We wanted to make sure everybody was cared for. Next slide. So as I come to a conclusion, I want to do a couple of quick highlights for you and then open up for questions. First, I want to say what's not there. There are things that, just were too much to list, but I want to just make sure that you know that we are there, because we're the kind of agency that is in the background often. We're the kind of agency that people don't always see, but we're often a partner at the table. And so when we begin to see trends and gaps in services, we're pulling people together to mobilize. So some of these are general trends, not surprising, some of which Dr. Rossman touched on, some of which you will hear when others come. You know, we know that there was a disproportionate impact during this pandemic on African American, Latinx communities, those who were foreign born, but also women, you know, women-owned businesses, you know, childcare, other things. There were populations who were disproportionately impacted. We're using our data to look at how we can help those groups. There were gaps that we identified. We absolutely need more bilingual staff. We need to provide staff who can speak multiple languages, who are able to help with accessibility, closing the gaps, being equity minded and equity driven. We know that social isolation was an issue for, as I talked about earlier. And I want to point out that access to food and housing supports has always been a critical need, but during this pandemic has even increased and continues to be a significant need in the county. So you can look at those details a little bit more as you have an opportunity to look at the slides in ongoing. Next slide. So I want to focus the last few minutes that I have on our critical needs. I want to say, think about a day like today, what you don't see. What you don't see in our department is that we have mobilized a code blue. So we're doing code blue sheltering because of the weather today. We've already mobilized and been working on the cold weather shelter, which we run with partnership with Grassroots from November through till the spring. That's already at capacity. We are working to maintain a COVID positive hoteling space in this spike. We have had a number of people in shelter test positive. We have to transition those and make the arrangements and contract for those people to be safe, provide food for those people, all kinds of things that you don't see. We are working with transportation on days like this to make sure that, you know, if the buses are not running, they let us know so that we can let the community know who needs to get to work, how they're going to get to work. When we're talking about, and you hear from people that come in and are going to present to you about other infrastructure needs like technology or workforce or schools or hospitals. Often we are working with those folks on any given day. The sheriff department is working with us to think about eviction prevention and how to work with a family. The police department is working with us on homeless person's case or a human trafficking survivor. You know, these are the things. The hospital is working with us on discharge planning for a vulnerable person. May not be homeless, but just may have some vulnerabilities and they can't go home by themselves. So on a daily basis, we are working with these kinds of cases and looking at the systems that are needed to care for them and the policies that might be interfering with our ability to provide seamless services. The message is that these problems that we are seeing today in the community are increasingly complex. So when you look at our service challenges, our community needs are growing as a result of the pandemic, but they were also growing before then. They're increasingly complex, the rising numbers of those in need of assistance, and the beauty of our diversity in our county is that we have to have systems, though, that are able to respond to those diverse and culturally appropriate, those needs in a culturally appropriate manner. So that becomes a bit of a challenge. Food access isn't just food access for a culture who does not perhaps celebrate the same holidays or have the same dietary requirements. So the diversity that we have to have an insight around an equitable measure of services around food access takes a whole different lens. So that means go up to the top, our infrastructure, the people piece is critical for us. We are struggling, like Dr. Rossman talked about and others will talk about, with recruitment. Human services is different today than what it was even, pre-pandemic or even just last year. The skill set is different. We need a higher level skill set. We have to be able to compete with our salaries, and people are exhausted. You'll hear that, I'm sure. Their workloads are growing. And my budget, while 80% people, I need more people. And I need the flexibility to recruit people with a different kind of skill set. Technology is key. People don't think about data analytics, research, policy. Those things undergird what we need. And as we bring in more grants, we need support to support those grants. So on the fiscal side, the reporting, all the kinds of things that are needed to support an agency like ours, the paradigm has shifted and is changing. That is a challenge for us to recruit and retain people to be able to meet the needs of what we're seeing in this community. And then lastly, that evolution of human services. I've talked about it some, but our role has expanded in a critical way. Emergency preparedness and response. We're responding to snow, we're responding to hurricanes, we're responding to floods, we're responding to pandemics, vaccine clinics. Our staff is today preparing to host a vaccine clinic tomorrow for 5 to 11-year-olds. We are being called to do, and I'm happy to do it, but we're being called to do the things that people don't really think about when it comes to us. So when people are coming before you, my goal of this presentation is to have you think about, hey, is this something that also in the background DCRS is a part of? We have oversight for critical services now. We are funding at a higher level and developing partnerships in ways that we have not before because of the kinds of needs we have. So we are not your usual human service agency, but also we couldn't do it without our partners. What's clear about what we're seeing is that the needs are bigger than one individual agency. And oftentimes we are playing quarterback because people are coming through our door first. And our role is to make sure they get what they need and we get good, solid outcomes and create a community that when the business community is recruiting or workforce is training and other people are thinking about moving here, it's the kind of community that has what it needs to make sure their folks can thrive. So I know that's a lot. I'm going to stop there and I thank you for your time.
Thanks, Jackie. This is Steve Point. Quick question for you on your funding. The funds that come in for the nonprofits, the grant programs that you run, are those funds separated from what you can use for your own general administrative funds?
Yes, they are.
Okay. Thank you.
This is Joan Dreesen. If I could just emphasize first how strong the partnership is with DCRS and how valuable it is. I also want to emphasize how many of the direct services nonprofits actually provide. So when we talk about level funding for CSP for 5 years, that's a real cut as the needs have increased and we have to address more of them. That is a cut for our nonprofits who already paid amazingly low salaries, often have no benefits for their employees, use volunteers to a very high level to reduce the cost to the county. We are having trouble right now. If you want to talk about staffing, the turnover that we're seeing is huge. Our ability to fill critical positions is impossible right now. And so I guess I would really like for this committee to consider an increase in that CSP. It is just, it's not doable anymore. And we're really in a crisis state. So thank you.
Thanks, Joan. I think what we're all feeling across all industries is that same thing. It's not just something that's impacting your agency and Jackie's agency and government agencies. It's impacting business as well. I mean, it's very, very, very hard to find staffing, to compete for staffing, and to be able to afford staffing. So I think we hear you.
And I absolutely agree. I think, though, when you look at what we ask of our nonprofit employees, the task that the direct care that they have to provide, and the already low salaries that they were willing to take because they are passionate about giving back. But there comes a point where you just can't do that anymore. And
No, I agree.
particularly
I
as
don't think I
stress
was.
is
I
to
don't
the
think I was
families.
disputing that, Joan. I think
Okay.
I was supporting it and sharing it.
Yeah, it's just, it really is at a crisis stage, both at middle management, leadership, and direct care levels. And it's something I think
We had 4.5 million people leave the workforce in November of
Exactly.
2021. I think we're all in a crisis stage, and I understand that that means you are even more of a crisis stage.
Thank you, Steve.
You're welcome. Are there any other questions for Jackie?
Yeah, I have one quick question. Jackie, how is the new minimum wage legislation going to affect your ask for the next budget?
I may have to yield that question to Holly. You know, our HR has worked with us, and Holly's team is great in working with us to look at those positions that we have that are sort of at that level, and we'll be looking at what that means for us. Off the bat, I think it's what Stephen has talked about in terms of our ability to recruit. It really affects whether or not that it was law or not. People are looking at salaries. It is tough for us to recruit some of those positions at even a $15 an hour wage, because we know you can't live in Howard County off of that, and it's difficult you talk about the Alice population and others. So, but I have not done a calculation to know what that impact will be on us at this point.
Craig, that legislation, when would that go into effect if it were to pass? Is there a time frame? Is it fiscal year 23, 24?
It's already passed, and it will be affecting the next fiscal year.
Okay, so everybody here who's presenting to us hasn't factored that into their budgets?
I understand for county government. I think you'll see that from rec and parks, definitely when they come in because of their seasonal workers. And I understand they may affect some of Jackie's staff and some of the other CSPs that are not currently making the amount of money. I don't know of any.
Jackie, is that something you could do and get back to the committee over the next few weeks and just let us know what that impact would be in addition to what you presented here?
Absolutely, absolutely. And we've shared our concern of the human service area has historically been one that we have constantly, looked at in terms of our salaries. We have not increased in salary for some time now, and our partners and colleagues in HR, and as I said, Holly's team, others are very cognizant of that and are looking across the board at how to support us going forward. But we can definitely look at that. We know I can identify the positions very easily for you.
Yeah, I was just from a number, because you
so,
put in here,
sure.
put in here, what your request is, and it would be good just to understand, well, what's the delta between what you've done and what it would be, just so that the committee is aware of those impacts. And Craig, I hope as we go through the rest of the process, that's been included throughout the analysis. But I agree with Jackie. I think given when the legislation, I guess it was already passed, but given when it was passed and given what we're going through right now, those numbers, they're just non-existent into the economy that we're in right now. I mean, the inflation of the wage inflation that we're seeing to try to retain people is just really, really high right now. Anyway.
And Steve, thank you for the question there. We actually, there are some fiscal impact analysis, both auditor's office and budget did that. So that's, we can share that was about the scope on that, but still that was essentially a guesstimate mostly based on the seasonal workers and those small number of employees that actually at the lower minimum wage, below the minimum wage proposed there.
Yeah.
But there,
I mean, but to Joan and
bigger
Jackie's
scope
point,
is, yeah,
they're going to now compete. You know, I'm telling you, in the business world, we can't get employees, right? So,
yeah.
so people are going to see open opportunities, and they have qualifications that they're going to use. And yes, they're very passionate people, but there comes a point when you say, I have to do something different for my family. I have to do something different for myself, and I can go make 20 or 25% more.
Yeah.
And that's meaningful. You know, I've got student loan debt. I've got all these other things that eventually I'm going to have to start paying again. And, you know, taking a minimum wage to a level and understanding the fiscal impact of that number is one thing, but understanding what the wage inflation impact to our county government, that's probably slightly different.
Yes.
And Steve, if I could emphasize too, I know I said it, but so many nonprofits provide absolutely no benefits, no health benefits, no retirement. That's not something that's sustainable moving forward. And I think the CSP grants are going to need to incorporate some of that, and we're going to almost need to make that mandatory, because we cannot hire if we don't. And in some cases, I just can't even imagine suggesting that someone take these positions when they do not offer benefits. So I just think that's something that needs to be a consideration moving forward.
Thank you, Joe.
For a great point, Joanne there. And also, we're running out of time, so I'm going to close in 1 minute there. But also, even the county and different entities continue to receive some federal funding. But as some of the speakers mentioned, that these are more like crisis focused on, and usually very restrictive on that. If we talk about addressing some long-term capacity issues, etc., that actually we eventually have to seek for the county's own sources, probably. Yeah. Okay.
Well, I mean, at the end of the day, and I know you want to end it. At the end of the day, it will follow to county revenues in a few years. It's not something that'll happen next year. It'll take a couple of years to get additional tax revenues that are coming from higher wages for county residents. But the issue is how do you get through that couple year period? So,
if I could make a quick context, obviously at Columbia Association, we're very impacted by the change in minimum wage. And just as quick context, since it sounds like maybe not everybody's familiar with the details, and it was introduced and passed inside 60 days, but in December, and the minimum wage that was slated for the state, obviously started January 1st at $12.50, but there's a 12% increase in Howard County on April 1st. So we happen to be in the midst of our budget, but that's going to split for us 2 fiscal years. But I think that the key is there's a 12% delta, just for general magnitude, in 3 months. And that does not count, obviously, compression calculations. And Holly, you were kind of, alluding to that. But just as a quick delta, it's a 12% change in a single year.
Can I just note that I think
thanks, Lacey.
that what Joan is talking about is really that we need to rethink what we believe nonprofit models should look like, because you can no longer expect that level of service if you're not even able to provide the services to your employees that they are trying to make sure are enforced and provided elsewhere. The tilted idea of what admin costs and overhead are supposed to be for nonprofits is going to have to change. You cannot expect people to continue to deliver services at this level when they can't even take care of their own families. Just a thought.
And I think just to bring it home for the committee, and we should end after this, Holly, is that, given the county's reliance on nonprofits for a number of services, that's where that tie is. So when you have all of these nonprofits that are handling certain services for the residents, the county's not handling it itself, that's you're creating this gap. And I think from the business community's perspective, we, you know, ignoring any mandates of minimum wage. I mean, my company, we increased well above all of these numbers 4 years ago. So when the business community was already doing it because they had to maintain staffing, and now it's going to follow on to others, well, that's just telling you that the business community is now even further beyond that, and that's just going to create even more strain. So that's all I'll say about that.
Thank you all so much. I mean, Jackie and all the speakers, thank you so much for your information, and also for the committee members that have offered great discussion today. Unfortunately, because we are running against the deadline, so I'm closing shortly. But we will continue the dialogue in the coming weeks or longer. And also, if you have questions, feel free to send to me, and also I'll channel to the right agencies here, or you can contact them directly. We already provided contacts here. Next week is Thursday morning, 7 to 9. Same way we do virtual meeting, and we also have other agencies that actually you will find interested in. That's public safety, including the body worn camera program discussion, as well as EDA, who has been engaged a lot in dealing with helping business community impacted by the pandemic, and also our IT department, who are also heroes throughout the pandemic, is supporting everyone there. So we have plenty to continue starting from next week there. And thank you everybody for your time. I really appreciate that, and have a good day.
Thank you, everyone.
Yeah, thanks, Holly.